Meanwhile, in northern Minnesota, mental health help is now available for farmers through a program of the Lake Superior Community Health Center. The Twin Ports-based center is modeling its resources around similar work with farmers in southern Minnesota over the past 2 decades. Here to tell us more is Rich Tunell, the Rural Mental Health Program Coordinator at the Health Center, and Jessie Peterson is the Chief Operating Officer at Lake Superior Community Health Center. And thanks to both of you for coming in. An interesting area of expertise you have in terms of dealing with the mental health issues specifically related to farmers. Can you talk, Rich, about some of the real specific concerns that farmers in this area might be experiencing both in a typical year and maybe those that are a little more pronounced because of COVID-19?
Yes. Farming is stressful as it is. I mean, there are always so many variables in farming that they don't necessarily see right away, because like pricing and how their produce is doing, how the workflow is going to go when it hits the manufacturing area. I mean, there's so many different variables with that. And so just trying to try to focus on what they can do today in their farm and on a daily basis is stressful. Now you add COVID to it. Now with COVID recently, just the interruption in the workflow caused a lot of concerns. When the schools shut down, when the restaurants shut down, now all of a sudden all the things that they were purchasing and all the workflow that was set up to go to those areas is now stopped. So that put a backlog on the workflow. So now the farmers themselves all of a sudden have all this excess, trying to figure out what to do with it. So that is kind of mellowed out a little bit. They're working through that, but that's always, it's going to be a concern for quite a while, because if the work processing plant has an issue with COVID or whatever that hits them, and they have to shut down or partially shut down, now you have another issue that the farmer has to end up dealing with.
Now, Jessie, the Rural Mental Health Support Program is new and came on board after COVID was an issue here, but I understand that it was actually in the works for a long time before that. Talk about how it came to be.
Yeah, absolutely. I think we're just really fortunate as a community health center to have the opportunity to be innovative, and our mission, improving access to quality healthcare for all, allows us to continually be focused on what population is in need and how do we meet that need. In this particular case, what we're really fortunate is that we also have the Miller-Dwan Foundation here in the Twin Ports. And to the credit of the Miller-Dwan Foundation, when we reached out and when we said we're aware of this incredible need amongst our agricultural community for mental health services that are offered in a completely unique way. Not every farmer can get out of the fields to come in for an hour therapy session once a week. Not every family dynamic also is willing to deal with that stigma of coming in and dealing with that. So when we approached the foundation, they were on board and they thought it was a great idea. We are modeling this after a really successful program that started in southern Minnesota, and we've had the good fortune of Ted Matthews and his mentorship in helping us to build our program for northern Minnesota. And so again, what we're able to do is to say, we're here to meet our clients really, truly where they're at. And in this case, that means therapy in a very unique model and something that just isn't being offered really anywhere else. And so it's just been a really fun partnership. And yes, we have been working on this for about 1.5 years, and then COVID struck and we said, well, there's even more need now. And the isolation and the impacts of that lent themselves even more to this style of therapy where Rich is able to get a phone call, he's able to talk through whatever issues might be arising and not having to have someone come into the office. So it's been a really wonderful partnership.
Rich, talk about some of the services or resources that are available and how you're reaching out to connect with those folks who might need them.
Well, right now, basically any calls that I get from the farmers or any other agricultural area, I'm willing to meet with them on their farm whenever they want to, and really the focus of this is with their mental health. It's dealing with the stresses, their depression, their anxieties. It's not, the way we've set this up is it's a fully funded program, so there is no cost, there's no insurance that we have to deal with. We don't have to worry about trying to diagnose for a mental illness and do all the paperwork for that. So this is really a unique program that way, where all we have to do is be there for the farmers and the other agriculture folks.
Jessie mentioned the stigma that has to be overcome, not just with the agricultural community, but pretty much in society-wide when it comes to mental health. There's a perception of farmers as maybe rugged, stoic,
Yes.
you know, tough. How do you break through that and just kind of let them know that it's okay to reach out for help? And
That
you're
is.
there?
That's a huge part of this. And that's, when we started this program, it's one of the reasons that we were told that it's going to take a while to get it up and running. And it's really just trying to build that trust relationship and to maybe let the farmers or their family understand that we're not there, we're there mainly just to help and be a third party, just to listen and to guide where they might need some guidance on how to handle situations, how to handle their anger, how to handle their frustrations, how to communicate better. And a lot of times it might not come from the farmer directly because they don't want to talk about themselves and their emotions, but it might be a family member that encourages them. And this is an occupation that is very prone to suicide. And so if there are people out there that can see someone pulling back, doing things that they wouldn't normally do, that's the time to really reach out and talk to someone like me or other counselors. And for me, it's like I said, it's a unique case where I can go and see them on where they're the most comfortable, at the time they're most comfortable with, on the farm, in an office. It's not like a normal mental health facility where they have to come to town, they meet in an office for 50 minutes, and then you get up and leave. I've spent 2 to 3 hours with a couple, just talking, seeing where they're at and how things are going and how I can help. And that's been very beneficial.
Is there a whole network of other resources that are available to people who access this program because this is part of the Community Health Center?
Absolutely, that's a great question. So, this is a very unique program in the fact that we are able to meet them where they're at, but anyone who accesses this program, we also, as a community health center, like to say there's no wrong door. So if somebody meets with Rich and they also need a primary care medical provider, we'll get them in for a medical appointment. If they need dental care, if they need other more structured behavioral health, substance abuse, we now offer chiropractic care. So we are continually growing also healthcare insurance navigation. So we really are proud of the fact that we offer this integrated care. And so for us, if what they need is for Rich to be there for a few hours and to listen, that's enough. But if they want to come in and to become a part of our healthcare family, absolutely. They're absolutely welcome in.
We were talking a little bit before we went on the air about how initial plans were to maybe meet with people at county fairs and get out there. Well, the pandemic has put the kibosh on that. How can people connect with you? What's the best way to get in touch and to access these services?
To call Lake Superior Community Health Center is a big one. I have a direct phone number that's on that website, which is Lake Superior Community Health Center. All right. And I have a direct number that they can call me and reach me. I carry that phone with me wherever I go. So those are the two best ways of reaching me for any of these services for the farm.
All right. Well, we hope that we educated some people out in the community about the program and that maybe your phone will start ringing and you can do some help.
Really appreciate the opportunity to come here today.
All right.
Thank you.
Rich, Jessie, thank you.